Thank you for your purchase of the Gendron Bariatric Patient Lift. Let us walk you through the operation of your lift. The lift arrives fully assembled. It's important to note that your lift is heavy. You should avoid lifting without assistance to avoid personal injury. To charge the lift battery, install battery onto lift and plug in the AC cable. Please note the lift is inoperable when the lift is charging. Always perform the following checks before using the lift. 1. Do a careful walk around the lift. Carefully look for any damage to the legs, mast, lifting arm, or spreader bar assembly. 2. Inspect the lift actuators to ensure bolts and nuts are tight. 3. Lock the rear casters in place. 4. Check the battery level. If the battery is low, charge it. 5. Check the sling for any wear or damage. Select the appropriate sling size for the patient. The Gendron sling has 4 each permanently attached main lifting loops and floor lift extension straps, 2 each on each side. The front main lifting loops are longer than the back main lifting loops. The back main lifting loops are the ones that will be closer to the patient's back and should be put on the spreader bar first after the sling is positioned with the patient, then followed by the front loops. The 8-button 4-function handset, shown here, controls the 4 functions of the lift positioning. Extend and retract the legs. Open and close the legs. Raise and lower the lifting arm. Rotate the mast and lifting arm left and right. Please note that the lift legs must be fully extended and completely opened before elevating the lifting arm or rotating the mast. The electronic safety feature will not allow the lifting arm to elevate or the mast to rotate unless the legs are fully extended and completely open. Once you have the lift in the desired position for the patient, lock the rear casters. You will need to open the base legs and then extend them using the pendant. Using the pendant, press the buttons to carefully lift the patient and rotate the mast as needed for transfer. Please note that after lift use and patient transfer, the mast must be set back in center or home position in order for the legs to retract. And again, remember that the lift arm will not raise and the mast will not rotate if the legs are not fully opened and extended. Please reference the troubleshooting table in the manual should you need to. Contact your Gramfield representative for more information.